Welcome to my channel. Please subscribe, click the notification bell, like, comment and share.
On this video, Lola will be telling you about acne, the effects, treatments, how to prevent and control acne. Please sit back and watch this highly educative 24 minutes clip.
Hello guys, welcome back to my YouTube channel. Once again, my name is Lola if you've not met me on this channel, and this is Vicky's Escapades. So for today we're going to be talking about a very popular disease condition, and then this popular disease condition can even be mistaken for one of its symptoms, and this popular disease condition name is acne. Acne can be sometimes mistaken for pimples, but they are not the same. Pimples is actually one of the symptoms of acne. Okay, so let's get right into the video. But before we do that, let's take a pause. Have you subscribed? Please do that now, and then like, leave a comment, share, so people can get to hear about this information I'm about to share with you. And after that is done, don't forget to click on the notification bell so you get notified whenever we drop any new video, so you won't miss out on all this useful and juicy information. So without further ado, let's get right into the video. Without much further ado, let's get right into the video. Yes. Okay, so what is acne? Okay, but before I get into it, pardon me if I am looking towards this side.
That's because I jotted out some things so I wouldn't miss out on anything I want to discuss with you guys.
So what is acne? Acne is a disease condition that affects most people at some point, especially teenagers. You know, it causes spots, oily skin, and sometimes skin that is hot or painful to touch. Another definition of acne is that it is a disorder of the skin caused by inflammation of the skin glands, you know, and hair follicles. So, you know, this disorder can majorly be found in adolescents. So that's what acne is. And if you want more information, Google is your friend. But yeah, I am yet to play Google for now. So let's keep moving. So acne mostly and commonly develops on the face, the back, and the chest. These are the places you can find acne. And there are about, I think, 6 types of, you know, spots. There are 6 types of acne. We have the whiteheads, we have the blackheads, the papules, the pustules, the nodules, and the cysts. Okay, so I think, you know, the blackheads are those small black or yellowish bumps that develop on the skin, and they are not usually filled with dirt. They are dirt free, but are black because of the inner lining of the hair follicles. So that's why they're always black, because of the inner lining of the hair follicles. Because they're black doesn't mean they are dirty or they are filled with dirt. And then we have the whitehead. They have a similar appearance to the blackheads, but they may be firmer and won't, you know, when you squeeze them, they won't be empty. They'll come out with something. But they are also very similar to, you know, and that's the most common one. So you know, the papules, those are the small red bumps that feel sore and tender when you touch them. The pustules, similar to papules. You know, all these things, they have similar features. The pustules, the nodules, those are larger hard bumps. Then the cysts, you know, that severe type of spots, you know, caused by acne. They are the most severe. Those ones are really high graded acne. So what do you do if you have acne? That's a self-care you can actually think of doing when you notice that, oh, your face or your back or your chest is filled with acne. There are different things you can do. So I feel like it is advisable not to wash the affected part of the skin more than twice a day. Frequent washing can irritate the skin and even make the symptoms worsen. Like if you keep washing, especially those that like scrubbing their faces, so it can cause more irritation to the skin. So try your best not to wash more than twice a day, and then ensure that whenever you're washing, you don't wash with all this antiseptic soap, you know, all this concentrated soap. Wash with mild soap or cleanser and lukewarm water, you know. So the lukewarm water will help open up your pores. the pores on your skin, and then help the soap you're using to really penetrate inside and everything. So but then very cold or very hot water can actually make this acne worse, and we don't want to do that. So ensure you wash your face with mild soap and lukewarm water. Then don't try to clean out your blackheads or squeeze it. Okay. Here's a fun fact. I am actually addicted. That's what I would say. Although now I'm trying to work on that addiction. I know some people at home are like me, but I would really advise you to stop, because it hasn't done me any good, and it wouldn't do anybody any good. Mine is so worse. I'm addicted to squeezing out pimples, not just for myself, even when I see on people, especially those who are close to me, not just anyhow people. Let's get that straight. So even when I see pimples on people, I'm always like really, like my close pals and family, I'm always like really, so I feel this urge to go and just pop it, even my face. So there was a time, I think around last month or 2 months ago, I dealt with a whole lot. I'm still dealing, because like that's why I just felt the urge that let me talk about acne, because I'm sure there are lots and lots of people that will be going through what I am going through, because it's no joke. Once this thing is there, it can take 3 months or even more than to clear off, and that's if you're doing the necessary things you ought to do. So, and another thing you shouldn't do is that if you press and you press these things, it can result into permanent scarring of your face, and you wouldn't like that. And then it will endeavor you to start using makeup to cover up your face every single time you're going out. And this is not, even when you're trying to treat acne, you need to avoid too much makeup and cosmetics, because then all this, and even if at all you want to use makeup, use the water-based, not the oily-based. The water-based will help open up your pores and just help your acne not get worse. Yeah, that's it. So it won't get worse. And there's one thing some people, and I'm sure it's a few persons that actually just do this, not a whole lot of persons, and that is not cleaning up your makeup completely. You have to clean it, like completely remove your makeup before you go to bed. Completely remove your makeup. And if dry skin is a problem, use a fragrance-free water-based emollient. These emollients are skin softeners and sootheners, like they help to soothen and soften the skin. So use a fragrance-free water-based emollient, please and please. Regular exercise can't improve your acne, but it can boost your mood and improve your self-esteem. Ensure that once you're exercising, you shower as soon as possible, as soon as you're done exercising. Don't wait, relax and say, I just finished showering, and I just finished exercising, and let me quickly go and take my breakfast first before going to shower. No, ensure you shower immediately once you finish exercising, because sweat can irritate your acne. It can make it worse. And then one other thing is wash your hair regularly and avoid your hair touching your face. This is talking to me just like this now. So imagine I've already rubbed a whole lot of things on my face and all those things, and then my hair is beginning to touch my face. So avoid that as much as possible. I know it might not be so easy, but these are things, just self-care that one can actually put into actions and make the whole acne issue that seemed like a big problem become a very small problem. Acne is not, it can't be cured. It can only be treated symptomatically. Yes, it cannot be cured. It can only be controlled with treatment. Several creams, lotions, and gel for treating spots are available. You can always get them over the counter at the pharmacy. So you can, but ensure you speak to a pharmacist whenever you want to get acne, lotions and creams for your acne, so you won't get the wrong thing for your skin type, because it won't be advisable to get something that won't work for you. And you need to be patient when treating acne, because the treatment with so much consistency can take up to and more than 2 months, even up to 3 months. Like it can take up to more than 3 months. And then so you shouldn't get frustrated and get tired and say, oh, I've been treating this thing for 2 weeks, no results. Just keep moving. Do not give up. Just keep moving, because when they start working, they are usually very good. Like you will enjoy the results you're going to get once you work on once you're consistent, you're determined and all these things. So if your acne is severe, if it's too much and you've used all these products, you don't know what to do, I feel like the best thing to do is to see a dermatologist. Or okay, maybe if a dermatologist is not close to you, just see a general practitioner, see a doctor. I'm sure the doctor will have a dermatologist to refer you to, but do not try to treat it. A lot of things happen these days, and most ladies are a victim of it. You go to, you see lots of people selling skincare products online. You don't even, okay, because you're seeing results. You don't care about the skin type you have, how worse and bad your acne is, the type of acne you have. You just go, you buy different skincare products, and then it starts making a part of your face light, a part of the other parts dark, and then you start complaining and all those things. Okay, the truth is, some of the people that are actually selling all these products, some of them, or maybe a few of them, are well knowledgeable when it comes to the product they are trying to sell. Okay, the girl, I actually have a lady I buy from, like, these days. Okay, there are 2 people I buy from, 2 companies I buy from, and the truth is they've really worked, because I told them my skin type, or I do not have a very oily skin, or it's not even oily at all. So, and it's not so dry, it's just normal. So, and then I told them how often I get pimples, blackheads, and all these things. So, and then they were able to really help me out. But my own professional advice is that you should actually talk to a doctor, because a doctor will know best, especially a dermatologist. Okay, so I have this client then that had lots of reaction. I think she was reacting to cream or something. She changed her soap and her cream, and she started reacting. So we now tried, like, she has serious reaction, this anaphylactic reaction. Her face was swollen, see lots of bumps and all those things. So we now had to start using, I think then I just told her, oh, let's take loratadine, or if loratadine is not working, we can try piriton, and then calamine lotion. We did all these things, it wasn't working. So I now had to just advise we visit a dermatologist. And funny enough, when we got to a dermatologist, the dermatologist prescribed anti-allergic injections she was given at the hospital, and then prescribed drugs, cream and soap, and told us that she shouldn't be bathing with this hard sponge. And then I think the lotion she started using then was Aveeno products are actually really nice, like really, really nice. So she was in that product, and after, like, give or take, I can't really remember because it's been a while, but after like 3 to 5 days, like, she got better. Like, I'm not even sure it's up to that 5 days. She got really, 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 really better. Okay, now, so I'm sure the question that'll be on our minds is, what causes acne? What are the reasons for acne? Why is there acne? Okay, acne is most commonly linked to the changes in our hormones, like our hormone levels during puberty. That stage is when the whole thing starts popping up, but it doesn't mean one cannot start from any age. You can start from any age, but it is usually linked to the changes that occur, during that period. So, certain hormones cause the grease-producing glands next to the hair follicles in the skin to produce larger amounts of oil. Certain hormone, that's abnormal sebum. The larger amount of oil is abnormal sebum. So these things, causes serious acne. So other possible causes, the major cause of acne is hormonal changes. So other possible causes, funny enough, acne can be hereditary. It runs in families. Maybe your mom has acne, or in a family they have acne. They deal with acne. Acne is like an issue. You too, it's possible you start, having acne and all those things. So it can be hereditary, it runs in the family. As I've said before, hormonal changes such as those that occur during menstrual cycle. Even during pregnancy, you see some women when they are pregnant, you'll be like, what's really going on? Because the level at which they'll have this whole acne thing is going to be so amazing. Like it's going to pop out and be like, what's going on? So that is also like a cause. And there is no evidence that diet actually causes acne, poor hygiene, or sexual activity. But then I feel like, okay, that was what I said when I said, if you exercise regularly and then you fail to shower immediately after exercising, your sweat can irritate your skin, and then boom, acne. And then diet, I feel like, although it has not been medically proven, no evidence yet, but I noticed that, let me give you a scenario. I noticed that I've been taking, because I love boiled granules a lot, so I noticed that I've been taking lots of boiled granules. Then I was taking Snickers. Snickers has nuts in it, so I kept taking these things. I think I was taking almond nuts also. So I noticed that while taking all these things, I started developing lots and lots of pimples on my face. That's a symptom of acne. Lots and lots and lots and lots. And because of my bad habits, what would I even call it, safe? Because of this, my addiction to always, so I kept popping and squeezing, and then it started becoming black spots. You can even still see some traces and all those things. So, and I feel like it's because the nuts contain omega-6 fatty acids. These omega-6 fatty acids, you can see them in walnuts. I feel like it's in nuts generally, and then in fish. So the best fatty acid to take is omega-3 fatty acid. So that's one type of food. So another food that can possibly cause acne is these dairy products. That's milk, yogurt, and all this stuff. Another fun fact, I was taking a whole lot of yogurt. I had serious and massive breakout that I was so angry. I was telling a friend of mine that what's really causing all these things. It was when I now sat down, I thought about it, and I said, it could be this. And all these things that I experienced during these last 2 months made me say, people need to know about this acne, and they need to know the do's and don'ts when it comes to acne. Things you shouldn't even play with. That's resist it as much as possible. Resist popping and squeezing. It might be difficult for some people, because I can't lie to you, it is so difficult for me, but resist it. Like, control yourself, because it is you that will carry the cross. So once you start seeing all those black spots, and then you can't do without makeup, and then makeup self can eventually make it worse. So all these things. So the other food that is all these sugary foods, like grains, starchy foods, sugary foods, can also like cause acne. Even fast food can cause acne. And then chocolates. Oh my god, chocolates, oh god, these are the things that I really, really love. And now they are saying these things. When I did my research, although I had little knowledge, I wanted to research more on acne and bring to you guys. So when I was reading all this stuff, I was like,
Lola, this is really, really speaking to you.
Because when it comes to nuts, chocolates, I love fish. All these things, I was taking them back to back. I love oil. Like, I was taking them back to back. I think I've been taking them since about 3 months ago, back to back. I kept taking them. And then foods that you're sensitive to. can also like cause a breakout, like acne breakout. So who are those that are affected? Although there is no, sorry, let me chip this in. There is no evidence that diet can play a role, but it does play a significant role if you look at it well. If you monitor yourself, monitor what you're eating, your food intake, your diet, you will realize that, oh, it is when you start taking so meal, that's when you start having, you know, all these breakouts. So who are those that are affected? Majorly teenagers and young adults. Majorly, and I'm a young adult, am I not? So majorly teenagers and young adults are affected with acne. Yeah. And I think when I did research, they said about 80% of people aged between 11 to 30 are majorly affected. So I think that's basically it. That's basically everything you need to know about acne. This acne thing is serious. Like, our face is the first thing. Our face is actually usually the first thing. This face is the first thing people notice when they're coming to talk to you. So we have to always put into consideration what we eat, so it won't affect our face. You know, the things we do, our lifestyle, your makeup before sleeping, take it off. If you have oily skin, or even if you don't, but you notice that in my family, acne, the people that battle with acne, there are a lot. So you can also like use water-based products. That's when it comes to your cosmetics. Please take this seriously, because acne might look like something little, but it can be depressing when you start dealing with it. I wasn't depressed though, but my mood was constantly changing when I just pick up the mirror and I look at my face and I'm like, hey, what's going on? Okay, this is what I'm going to do. One day I'm going to, because I'm still undergoing treatment, so I don't want to reveal now, but one day I'm going to reveal my face when I was battling with serious acne on my face. After I did all these things I outlined, you know, washing my face twice daily, not more than twice daily, not more than. In fact, what our advice is, because there's this research, I think I saw a video and they were like, our towel should be washed every 3 days because of the dirt, the germs, bacteria that we pack. And then the same towel you used to clean your body, clean everywhere, is the same towel you use on your face. So probably if you think you can do it, you can get a different towel, maybe like a small towel, to clean your body after clean your face rather after taking your bath, and then a different one. Then ensure you wash. If you can't do three like every 3 days, you can do every once a week. Just ensure your towel is always clean, neat. And then, so I feel like if you start doing all these things and watch the product you're getting, some product can really, your skin type might be different might be different from another person's skin, is always even different. So the kind of product that will work for you is not the same product that will work for me. So you should always learn to know your body, know your skin type before, and speak to a professional. You can speak to your pharmacist, but if it's a very severe acne, our advice you speak to your doctor or your dermatologist. So I'm gonna have to stop the video here. So in case you have any questions about acne, you want to get to know more, you can, leave a comment. And if you have like other opinions about the same acne, leave a comment. So my darlings, please do not forget to subscribe. I am here because of you, here to bring the information I have researched on to you guys, so you will learn. So please subscribe, like, comment, share, and turn up notifications so you get notified when we drop any videos. So this is me signing up right now. I'll see you some other time. Have a lovely, I don't know when you'll be watching this video, but have a lovely day, night, morning, and all those things. I love you so much. Thank you for being there. Bye.
Thanks for watching this video. Please like and comment on it. And don't forget to click the subscribe button.